Hey, it's not always my favorite part of the show, but we're here to exercise today, and of course we all need it. So today we're going to be working on our core and our quads and a whole bunch of other things to help our back. Isn't that right, Dr. Charlie?
Correct. That's correct.
Dr. Charlie and I'm glad you're here to help me and everybody else too. So
Thank you for having me.
So what do we got?
Go ahead and lay on your back here.
All right.
Now, one of the main, common areas that are neglected when we have any kind of low back pain condition, etc., is our core. We've all talked about the core. We've learned all about it for the last several years.
Oh, yeah.
But when we normally have somebody do an abdominal exercise, which we're going to work on right now, is they tend to come all the way up into their knees.
That's what I was taught.
Okay? When you tend to do that, you've just incorporated your low back as well. Put a little strain there, aren't you?
Yeah, I feel it.
Okay?
I see what you're saying.
The abdominal muscle, when it contracts fully, watch me, ready? That's it. Anything past that is strain on the back. Okay, so let's learn how to do a little bit of abdominal work without affecting our lower back. So we're going to cross your arms. Okay? Keep your head neutral. Now what you're going to do with our repetition is you're going to roll up using your abdoms. Okay, there he goes. Okay, now back down. Okay, that's one repetition. Now in the middle of the repetition, go ahead and come back up. Squeeze real tight for count of 1. Then relax. Okay, up. Count of 1. Relax. Now you just worked out basically the whole center part of your abdominals. Okay, now the obliques, the abdominal obliques, this is the true antagonist of the lower back.
Okay.
Okay, so when you want to work those out, this is the next step. Bring the legs off to the side.
All right.
Keep your shoulders square.
Gotcha.
Okay, bring your shoulder up again. Squeeze real tight. Count of 1.
I feel it.
Relax.
Definitely
Up.
feel it.
Count of 1. Relax. Now, obviously, we need to remember that we need to do this on both sides.
All right.
Okay, let's go ahead and have you flip all the way over.
Wow.
So we've worked all the whole abdominal muscle groups in the front. Now we need to work on the antagonist in the back. Go ahead and pop yourself up onto your forearms.
Man, I
Yeah,
thought I was
I know.
going to get take a nap.
Okay, so back is arched.
Okay.
Okay, keep your head somewhat neutral. If you want to extend your head up, you can. What I want you to do is contract the muscle group back here. You feel that right there?
Yes.
Okay. Your repetition for this one, you're going to contract, squeeze for a count of 1, relax. Contract, squeeze for a count of 1, relax. Okay? Real simple. If you want to increase the endurance or the resistance of the lower back exercise, bring the feet up and hold up there for about an inch or two. Okay? And do the same thing. You feel the difference with that.
A little bit,
Going to
yes.
increase the resistance on the lower back. Okay? Go ahead and relax. Go ahead and have you sit up here. Okay? Now these are exercises that can be done, by anybody, any age, anywhere.
Simple.
Floor, couch, bed, you name it. It can be done.
So if I do those, you're telling me the crunches and stuff, I'm going to get my washboard stomach, right?
Wash tub.
Wash tub. Wash that yet, thanks.
We're working on we're working on the endurance of the muscle
Okay.
group, not so much as the strength. I mean, anybody can lift up the table. Question is, how long can they hold it up there?
But
Okay?
we're worried mostly
So we
about
want-
strengthening for the back, too.
Exactly. So we want the endurance all the way around that helps support and stabilize
Gotcha.
the lower back and the pelvis. Okay. Now another problem of chronic issues that people have is the tight muscles in the quads and or the hamstrings.
Oh, yeah.
Okay. Let's focus on the hamstring. We're going to do a little stretch with these hamstrings as well.
Okay.
Okay. Now, real simple. Most of the time, people grab their want to do their quad stretch. They're going to grab their foot,
Right.
and they're going to what? They're going to pull back.
Right.
Okay. What is that going to do? It's going to stretch your quad. Yeah, that's great. Except it's going to put
yeah, I feel a little bit.
more stress in
I
the
do.
lower part of your back.
Mhm.
Obviously, the name of the game is eliminate the stress.
Gotcha.
Okay. That's why we're doing these
Make it
stretches.
easier.
So what we're going to do is we're going to grab that. I'm just going to hold it nice and loose. Okay. I want the knees together.
Mm-hmm.
You should feel a little stretch right there in the quad.
Oh, yeah.
Okay. Now, if you want to really accentuate that, push the pelvis forward.
Oh.
You feel a bit of a stretch inside there,
That right through there.
right through there. Okay.
Wow.
Yeah, if somebody has a hard time with the balance issues, they can always use the wall,
Got a
whatnot,
friend?
or a friend. Another way they can possibly do it is if you put their foot up onto a chair. Same thing. Put the knees together. Okay. Arch back. Push the pelvis forward.
Oh, that
Okay.
is easy.
Getting a good
That does-
stretch
Wow, I
with
do
that.
feel it.
Okay.
So simple.
So very simple. Okay?
Not do what we used to do in football, lay on the ground and lay back. Nah.
No, don't do
Not
that.
good
That
for you.
puts too much stress on the knee.
Okay.
Again, the name of the game is eliminate the stress. Strain on those joints. Okay.
Sweet.
Last one we're going to have you do is a hamstring stretch. Okay. Normally, how you were always taught,
Lay
for
on the
years.
ground and,
Lay on the ground, legs straight out, those kind of
Right.
things. Cherry pickers down like this. Okay. When you're doing that,
ooh, I feel that in the knee.
you're feeling down the knee. You're stretching the tendon of the hamstring, and not necessarily the muscle. Okay.
Okay.
What you need to do, get yourself a step. It can be a step stool, it can be a stair, it can be a step going up into your garage, a curb, bleachers. My truck driving patients, I have them use the wheel hubs of their trucks you know,
Really, just the will help.
just real hub. Okay, real simple. Okay,
Whatever works.
whatever. Go and put your foot up on here with me.
Okay.
Okay. Now, straight leg, body weight is centered over that the back leg there.
Gotcha.
Keep a slight bend in the knee. Now, what we're going to do is we're going to be bending forward. We're not going to be moving the knee at all. And we're going to bend at the hip, almost like you're pushing your backside that way. Okay.
All right.
So just come forward. You should feel a stretch right in the muscle belly.
Yep.
Okay? Right inside there. Now, if the knee is open too much, you'll feel it down here, down by the knee. If the knee is closed too much, you know sometimes people feel it up. Now, you've been forward here. I want you to keep just like that.
Okay.
Now, just make sure you find the right angle to where you can put your hand back there on the back of the muscle, and you'll know when you hit it. Boom. There it is.
Mm-hmm.
Okay? Obviously, you need to make sure that we stretch both sides. Okay? Now, stretching on this, you're looking, you know, I would have people, I remember the 2, 4, 6, 8, 10.
All right.
Okay? Twice a day. All right?
Ooh, there it goes.
4 to 6 repetitions of each leg, of each stretch. Hold for slow count 8 to 10 seconds.
8 to 10 seconds.
8 to 10 seconds.
Wow.
Okay?
And it's supposed to help all this in here, which is going to
Yep,
support
quads
my
in here,
back muscles
exactly,
as
the
well.
whole deal in here, you know,
Okay.
is going to work on the support. We're going to shore that up. We're going to maintain, you know, some stability as far as the whole low back and pelvis.
So a lot of stuff they were teaching me in football many years ago
Many years ago.
was not good for my knees. Because you're right, I feel that strain in my knee on a lot of those. And, you know, we're not taught that.
No.
So,
Not at all.
all right. So I'm going to get my washed board stomach. And I'll get back to you, Dr. Charlie.
All right, thank you very much.
Appreciate it. This is good stuff. It's not that difficult either.
No, it's not. Anybody can do it.
Anybody can do it. Everybody should too. It's good for you. All right.
Very good.